biomedical image processing course. In this module, we will cover different techniques to detect lesions of non-proliferative diabetic retinopathy. Number 1, it is hard exudates. Among lesions caused by diabetic retinopathy, exudates are one of the most commonly occurring symptoms on the diabetic patients. They are associated with patches of vascular damage with leakage. The size and distribution of exudates may vary during the progression of the disease. Hard exudates represent leakage from surrounding capillaries and microaneurysm within the retina. If the lipid extends into the macular area, vision can be severely compromised. Exudates are typically manifested as random yellowish or white patches of varying size, shape and location also. They are either seen as individual spot, cluster or are found in large rings around the leaking capillaries on the retina of diabetic patient. Although exudates may absorb spontaneously, they usually tend to increase in volume in an untreated retina. Occasionally, they may be confused with drusen, seen in age-related macular degeneration, which appear more regularly distributed at the macula. The detection and quantification of exudates will significantly contribute to the mass screening and assessment of non-proliferative diabetic retinopathy. Next lesion is cotton wool spot. Cotton wool spot represent a traditional stage between NPDR or maculopathy and proliferative retinopathy. These abnormalities usually appears as little floppy round or oval areas in the retina with whitish color, usually adjacent to the area of hemorrhages on the retinal surfaces. Cotton wool spot come about due to the swelling of the surface layer of retina, which consists of nerve fiber. This swelling occurs because the blood supply to that area has been impaired, and in the absence of normal blood flow through the retinal vessels, the nerve fibers are injured in a particular location, resulting in swelling and the appearance of cotton wool spot lesion on the retina. In NPDR is not heeded and blood sugars are not controlled. The two latter stage of damage to the eye may occur, that is diabetic maculopathy and proliferative retinopathy of the population. The application of digital imaging to ophthalmology has now provided the possibility of processing retinal images to assist clinical diagnostics and the treatment plan needed to recover from the retinopathy. Retinal image analysis remarkably improves the diagnostic value of these images. In fact, with the advent of better and inexpensive ophthalmic imaging devices, along with the rapid growth of proper software for identifying those at risk of developing diabetic retinopathy among the diabetic patient. as well as the reduction in cost and increasing in computational power of computers, and advanced and cost-effective fundus image analysis system can be developed to assist ophthalmologists to make the diagnosis more efficiently. Such a system should be able to detect early sign of non-proliferative retinopathy, and it also provide objective diagnosis based on certain predefined set of criteria by the ophthalmologist. In addition to that, intraretinal fatty exudates are a visible sign of diabetic retinopathy and also a marker for the presence of coexistent retinal edema. If present in the macular area, edema and exudates are major cause of visual loss in the non-proliferative form of the diabetic retinopathy patients. Retinal edema and exudates in the central area are the clinical sign most closely linked with treatable visual loss among the subjects. Here we have concentrated on detecting exudates as the prime marker because it is likely that accumulating exudates is always associated with retinal edema, and unlike edema, exudates are more visible in ocular retinal photographs which we will capture of the retina of patients. Detecting exudates in the retina in a large number of images generated by screening programs which need to be repeated at least annually is very expensive in professional time and open to human error. Thus, the main objective of the investigation described in this work is to contribute novel methods to quantitatively diagnose and classify exudate lesions in color retinal images from non-proliferative diabetic retinopathy screening programs which has performed for society. The optic disc is the entrance and exit region of blood vessel and optic nerve to the retina, and its localized and segmentation is an important task in an automated retinal image analysis system. Indeed, optic disc localization is required as prerequisite for the subsequent stages in most algorithms applied for identification of the anatomical structure and pathologies in the retinal images. Since optic disc localization is also indispensable to our exudates identification task, another objective is to develop a technique for optic disc localization and segmentation of exudates from optic disc as well as other lesions. The input color retinal image is analyzed automatically, and an assessment of the level of retinopathy disease is derived after the analysis performed by software. The proposed method will then be able to choose diabetic patient who need further examination. In addition to the exudates detection, we will also quantify the areas of exudate lesions in an pixel-based scheme detection. This will allow numerous measurements to be made of the deterioration in the condition over time. In the first stage of the work, we put our data through two pre-processing steps. Typically, there is a wide variation in the color of the fundus from different patients, strongly correlated to skin pigments and the color of iris of the subject. Therefore, first step is to normalize the color of the images. In the second step, the contrast between the exudates and retinal background is enhanced, which will facilitate later for the classification as well as segmentation of the images. The contrast is not sufficient due to the internal attributes of exudate lesions and decreasing color saturation, especially in the peripheral of retina. Once the images have been pre-processed, exudate lesions can be identified automatically with the help of proposed pixel level exudate recognition approach. Then the diagnostic accuracy of this method is compared in terms of pixel resolution and image based criteria against a provided pixel level ground truth data set, which is openly available for the purpose of verification. Here we introduce two main criteria for assessing the diagnostic accuracy of our exudate detection techniques, that is lesion based and image based method. In lesion based criteria, each single exudate lesion is regarded as an individual connected region, where this region can be comprised of one or more pixel in a group to form that particular region. Each abnormal retinal image can be segmented into number of exudate regions by considering a set of retinal images and applying an appropriate segmentation or classification technique. A data set of exudate region will be created. Then the lesion based accuracy can be measured in terms of lesion sensitivity and specificity by comparing the gain result against ophthalmologist outline of the lesions which has been captured through the segmentation process. In non-proliferative diabetic retinopathy, the lesion based accuracy can be assessed either in pixel resolution basis or alternatively using bigger collection of pixels, that is 10 by 10 patches and patch resolution. Although creating an accurate pixel based ground truth by the physician is not an easy task, a pixel resolution comparison of the result is more precise than using patch resolution, as a pixel patch may only particularly occur exudate pixel on the retinal surface. Thus, effect of misclassification error for individual patches, that is exudates or non-exudate region on the retina, should be taken into consideration when the performance is not measured based on pixel resolution. In image-based diagnostic based assessment, the objective is to provide logical predicate of the condition of analyzed image. In this case, each image is examined and a decision is made to illustrate whether the image has some evidence of diabetic retinopathy, purely based on the absence or presence of exudates anywhere on the image surface. Hence, the system global image based accuracy can be measured using a proportion of the tested normal abnormal images to the number of images which are correctly identified. Three classifiers: K nearest neighbor called KNN, Gaussian quadratic GQ, and Gaussian mixture model, that is GMM, are investigated within the pixel level exudate recognition framework. By following those classifiers of machine learning or soft computing, we can do classification of exudates of type non-proliferative diabetic retinopathy. Each classifier is trained and tested against 4 different pixel dataset of exudates and non-exudates. We consider separate GMM as to estimate the distribution of each class, that is exudates and non-exudates, and combine the models into a classifier with the help of Bayesian theory classification technique. The GMM parameters are extracted by means of the expectation maximization algorithm to select an appropriate number of Gaussian component. The minimal description length criteria is applied. The optimum GMM classifier is caused to evaluate the effectiveness of our proposed approach by assessing the image based accuracy of the system on population of 67 unseen retinal images captured from diabetic subjects during initial exudate lesion identification, pixel level exudate recognition. False positive exudate candidates arise due to other pale objects including light reflection artifacts, cotton wool spots, and most significantly the optic disc of the retina itself. The optic disc is detected as candidate exudate pixel or region due to the similarity of its color to the exudate lesion. To mask the false positive optic disc pixel or region from the other exudate lesions, and due to the critical importance of location of the optic disc, author also address optic disc localization and segmentation problem with different level of accuracy. Two techniques are investigated including template matching and active contour based technique, sometimes also called snake mechanism. The first strategy provides an approximate location of the optic disc center. However, the optic disc can sometimes have an elliptical shape, and thus baseline plotting of the exact boundary is very much important while extracting such complicated lesion. Consequently, snake-based technique is developed to generate a more accurate disc boundary. Author have hand labeled through an expert consult ophthalmologist a number of optic disc regions appear on the retina. This allows author to develop a measure to accurately determine the performance of their proposed technique. Its results are fed into author exudate identification scheme to mask out the optic disc region from the computation which has been developed. Let us summarize. We have come across in this module lesions of non-proliferative diabetic retinopathy. Next, we will see the details about various feature extraction technique and their classification techniques too. Thank you very much.